Hey guys, Gretchen Zablocki here. We are at HealthStar in Jeff City today, actually, with Dr. Hussain and his Neuro A team. And so for our Wellness Wednesday today, we just wanted to check in with them and talk about neurology and exactly what they do and kind of some of the things that they treat here. So Dr. Hussain, why don't you start us off with what are some of the main common conditions that you see and treat here?
Typically, we see migraine, which is very common in the community, as well as seizure, different type of seizures that we treat. Then we treat neuropathy or sequelae of diabetes-related neurological condition. Then Parkinson's and tremors, and then multiple sclerosis. For seizures, we have a special treatment in terms of vagus nerve stimulator, and Jennifer take care of their adjustment and evaluation, and we do a lot of treatment for migraines. Especially, I've been doing botulinum toxin for quite some time, and recently we have this CGRP receptor inhibitor injections that patient can do by themselves. And Jennifer is the person who trained them and make them comfortable that they can take these treatment at home and that can help their conditions.
Okay. And then Ebot, as the neurotech here, what is your role? What do you do? What are you responsible for?
So I'm responsible for the diagnostic aspect of this practice. So I do a lot of the testing. So the testing that I do is EEG, which is an electroencephalogram, also known as a brainwave test. So that basically checks to see if you have seizure activity, things like that. The other testing that I do is a nerve conduction study / EMG. So Dr. Hussain actually does the EMG portion, which checks your muscles, your muscle health. I will do the nerve conduction study, which checks your nerve health, which is very important for patients that have like neuropathy and other conditions like that. And then for patients that have dementia and Alzheimer's, or we suspect them of that, we do a test we call a neurocognitive exam, and that checks their brain health as well as their memory, executive function, things like that. And then also we do tests for depression, which is a PHQ-9 as well as a GDS short form. So basically that's just layman terms for a questionnaire for patients.
Okay. And then Jennifer, as Dr. Hussain's physician assistant, he mentioned some of the things that you're responsible for, but what are your daily duties here and how do you interact with the patients?
So I'm actually a nurse practitioner, which
Gotcha.
is fine. I get confused for a PA all the time. No big deal. I usually treat the more stable patients in the practice. I do most of the follow-ups. Like Dr. Hussain said, I will help with the VNS, which is an implant used to control seizure activity.
Okay.
So we'll do adjustments and consultations and stuff like that. I also help train with injections and stuff for patients to do at home.
Okay. And you guys are accepting new patients?
Yes, we are.
And then do patients have to have a referral to come to you guys?
Yes, they do.
Okay, so primary care doctor sends you guys the referral.
Yeah, they can just ask, if they have heard about us, they can just ask their primary care doctor to send them over to us, and that should be more than enough.
Okay, great. Anything else you guys want the community to know about your office? And
So we have started a Facebook page for HealthStar Neurology.
Yay.
Basically, we just want to educate, our community. There are a lot of neurological conditions out there that are just not well known, even though they're pretty prevalent. So our goal is just to educate the community and help treat these conditions.
That's great. And so what is that listed under on Facebook so people can look
HealthStar
at?
Neurology.
Awesome. Great. Well, thank you guys for being with us today. Again, if you guys are having any of those neurological symptoms, migraines, the neuropathy, tremors, seizures, anything like that, make sure you check with your primary care doctor, get a referral, and get down here and see this great neuro team. Thanks, and have a great Wednesday.